maglache. I'm from the Philippines. Philippines is in Southeast Asia. So I am currently working with the University of North Carolina project, or in short, UNC project. I want everyone to have a closer look at the picture. Is it visible from the back? Can you see at the back? What comes to mind when you see these pictures? Today, we will be having a general Ebola awareness. This is not just a need for your specific group. No, this is a need for the whole country of Malawi. These are posters that are currently being circulated in public places around Malawi. This is a general information that the government of Malawi, through the Ministry of Health, wants to share with the people of Malawi. Yeah? So anyway, like this is like giving you a basic information on what is Ebola, what you need to know about Ebola. Let me give you a brief background first on the countries or how this outbreak came about. So the initial countries that were affected by Ebola are this. Let's put Nigeria out first. So initially, it is in this 2014 outbreak. So it happened in Guinea, Sierra Leone, and Liberia. So just to give you a picture, where is West Africa? In the whole continent of Africa. So in the West African region falls this side. You see Nigeria here, that's the big country. Liberia on the very edge. And then Guinea, Senegal, Ivory Coast. So this is the West African countries where Ebola has, the Ebola outbreak is where it's happening. Where is Malawi in this map? Malawi. Very good. Locating Malawi from the West Africa, we're a bit far from it. Yeah? So we ask ourselves, why do we need to be prepared? These are the reasons why do we need to be prepared. Why do we need to be prepared for this Ebola? Although it's not in our country now, although it's very far from Malawi. So first, there is an easy access to Malawi. How is this? We have the airports. This is migration of people. You have the border post. So there's no cure for Ebola currently. There is no drug that is available to cure Ebola. And another thing, there is no vaccine available. So a vaccine, as he said, that's correct. It's just given to a person, to a healthy person. And it is given as a precaution. Yeah? So a healthy person will receive a vaccine to protect him from getting that particular disease. So in case of Ebola, there's no available vaccine. Yeah? And then from the previous outbreaks, aside from the 2014, this year's outbreak, the fatality rate is 90%. I will explain to you about it. But for this current outbreak, this 2014 that is happening now, the fatality rate is around 52%. When you say fatality rate, this is from WHO statistics. Out of 3,069 cases, meaning those people who got infected with Ebola from the West African region, 52%, which is 1,552, dies. So half of them dies. Why? Because there's no available cure yet. And the disease is very potent. The virus is very potent. It can cause serious illness. I want you to know that Ebola, that structure, that like the ring structure that you saw earlier in the slides, that is the characteristic virus. That is a form of the virus that you can only see through an electron microscope. You cannot see the virus through your naked eye. So it can infect human, us, and non-human primates. The first outbreak, the initial recorded outbreak of Ebola, happened in 1976, and this is a simultaneous outbreak in Congo and in South Sudan. So Congo that time was called Zaire. Zaire, that's the name of Congo that time in 1976. So there is a river, in Congo called Ebola River. So near that river is a village where the first outbreak So that's why the name Ebola. So the name Ebola comes from that fever in Congo. The transmission of Ebola from Congo to other countries was brought about by fruit bats. So how does Ebola spread? How does the infection spread? Again, human-to-human transmission. This we need to remember. It is transmitted through direct contact to an infected person's body fluids and secretions. So also contact with a dead body. When a person died of Ebola, it doesn't mean that the virus dies with him. No, for some time, the virus is still active in that body of the dead person. I put this in a box because I want you to really put this in mind. Only sick people can transmit the disease. So who are at risk? Family members of the infected person. Why? Because you all live in the same house. You interact every day. Right? You live closely together. The healthcare workers who are in direct contact with the infected Ebola person. Because they are the ones giving care to these patients. Okay, what are the symptoms of Ebola? When we say symptoms, what do you understand of symptoms? Signs. Or like what a person manifests outwardly if you are sick. Yeah? Yeah? So it takes about 2 days to 21 days from initial contact with an infected person for a person to show symptoms of the disease. For the early symptoms, fever, the infected person will experience fever, nausea, like dizziness, headache, tiredness, or like pains, some body pains. Yeah? So on the late symptoms, the patient, the infected person now will be suffering from vomiting, diarrhea, coughing. And this vomiting, diarrhea, and the cough may contain now blood in their secretions. And the later stage could also, there's a manifestation of bleeding. Usually, what are the portals of exit of your body? The nose, the mouth. So it doesn't mean you're just bleeding from the nose or the mouth. That means you are bleeding internally, particularly your kidneys and your liver. Methods of prevention. Knowing how the disease is transmitted, then we are equipped now on how we can prevent the disease, right? You know how it is transmitted. So what do? You avoid contact with the body fluids, with the secretion of an infected person. Do not touch dead body. I don't know, maybe in some parts of Africa, it is common in the culture that they wash the body of a dead person. Right? Is it the same here in Malawi? Yes. So for a person who died of Ebola, it is not recommended to wash the body of the dead infected person. Yeah? For infection prevention. And then during funerals or burials, it should be facilitated if the person died of Ebola. The burial or funeral should be facilitated by a public health professional. And again, do not eat bushmeat or those fruit bats. And hand hygiene. So these are examples of we call this personal protective equipment that is usually being worn by healthcare workers. Yeah, so there is gloves, masks, goggles, gowns. And what is the most important prevention here that we can have in Malawi? That Ebola is not yet here. What do you think is the most important prevention? Most important and vital prevention is education. We need to be informed, right? So when do you seek medical help? But that's why I'm equipping you with the knowledge. You only suspect of Ebola if there is an exposure or a contact with a person who has the disease. Or maybe if you travel to the West African countries and you got exposed to infected people. And if you are showing signs and symptoms of the disease, Ebola can also only be confirmed through laboratory testing. Yeah. What do you do if you get sick? Again, seek medical help. Avoid contact with other people. Why? Because we don't want to spread the infection. So, and MOH, the Ministry of Health, they do not recommend home care. But in the case of an Ebola outbreak, we don't take care of these sick people at home. We refer them to the hospital. Yeah? Okay. Then what is the treatment? Earlier we said there's no specific treatment yet. Yeah? There's no specific treatment yet that is approved for Ebola. At this point in time, there is a certain drug called ZMAT. ZMAT. This is an experimental drug. The vaccine, the protective medication is under clinical trial right now. So it's not yet released for human consumption. So what is Malawi doing? What does the government do in preparation for this Ebola? Again, the border control, as I showed you the poster earlier. So these are all found in the different airports and border posts in Malawi. So there is a screening of travelers. So they screen for fever. So there's like a scanner to screen for the temperature of that person. And then there's an isolation room there in all border posts for patients that are, or for people that are suspected or under screening, showing symptoms and coming from this outbreak areas. And then what we're doing now, this is also an initiative by the Ministry of Health. In some areas, they're also conducting Ebola virus disease information campaign. This is to educate the public and the people on information about Ebola. And there's a designated treatment center for anyone coming into Malawi who are suspected of Ebola. They are brought to KCH, Kamuzu Central Hospital. Any questions? Okay. He's asking, in BBC, saying that the Ebola virus or outbreak is caused by body fluids. That's true or not? Let's be very specific. It is you can get Ebola from body fluids and secretions of an infected person. Yeah? Not just ordinary body fluids or secretions, but from an infected person. Okay? So I think that concludes, and thank you for the questions. That concludes our seminar on Ebola. The floor is closed, sorry. Let's answer that question later. Okay, let's have our